Turmeric has been used to treat various illnesses in the Indian subcontinent for thousands of years. In recent years, interest in turmeric has been high in the medical and scientific communities, as well as among culinary enthusiasts worldwide. Turmeric is the spice that gives curry its yellow color. The main active compounds contained within turmeric are called curcuminoids, the most important of which is curcumin. Curcumin was first isolated in 1815 by two scientists, Vogel and Peltier, working at the Harvard College Laboratory. Since that time, scientific interest in curcumin has remained high, primarily because of its medicinal properties. The journal, Food, describes the benefits of curcumin. It has been shown to benefit inflammatory conditions, metabolic syndrome, pain, and to help in the management of inflammatory and degenerative eye conditions. In addition, it has been shown to benefit the kidneys. While there appear to be countless therapeutic benefits to curcumin supplementation, most of these benefits are due to its antioxidant and anti-inflammatory effects. An article in Molecular Pharmaceutics discusses the poor bioavailability of curcumin when used by itself. This limits the amount of curcumin that can enter the system. The article states, despite the lower bioavailability, therapeutic efficacy of curcumin against various human diseases, including cancer, cardiovascular diseases, diabetes, arthritis, neurological diseases and Crohn's disease, has been documented. Enhanced bioavailability of curcumin in the near future is likely to bring this promising natural product to the forefront of therapeutic agents for treatment of human disease. But, now consider this. A study reported in the journal, Planta Medica, describes a randomized, crossover trial, of 8 healthy men that evaluated the bioavailability of curcumin alone, and curcumin with piperine, a component of black pepper. Its results showed the addition of piperine produced a 2000% increase in bioavailability compared to curcumin alone. Thus, the addition of piperine is needed to greatly enhance the effectiveness of curcumin. And, what can curcumin do for you? An article in the scientific publication, Nutrients, provides some specifics about the types of diseases for which curcumin has been shown to produce positive results. The article states, the therapeutic benefits of curcumin have been demonstrated in multiple chronic diseases, inflammation, arthritis, metabolic syndrome, liver disease, obesity, neurodegenerative diseases and, above all, in several cancers. The article lists a number of cancers for which curcumin has shown benefits including, breast cancer, lung cancer, hematological cancers involving blood, bone marrow, and lymphatic systems, cancers of the digestive system, colorectal cancer, pancreatic and hepatic cancers, prostate cancer, as well as head and neck cancers. How, exactly does curcumin help fight cancer? A medical explanation of how curcumin works against cancer is given in another article published in the scientific periodical, Molecules. It states, based on its distinct chemical properties, curcumin interacts with numerous extracellular and intracellular molecules that are actively involved in cancer initiation and progression, thereby inhibiting cancer progression. However, it was not until 1987 that the anti-cancer property of curcumin was evidenced by Cutton and others, where topical application of curcumin on the skin proved to be effective against external, cancerous lesions. The multifaceted role of curcumin has been demonstrated in various human clinical trials over the past quarter century against many diseases including cancer, cardiovascular disease, diabetes, oral lichen planus, which is an ongoing inflammatory condition that affects mucous membranes inside the mouth, arthritis, and beta thalassemia, which comprises a group of inherited blood disorders. As you can tell, curcumin seems to be almost a miracle herb that helps the entire body to heal itself. A paper in the journal Food Chemistry described tests using curcumin and 2 human influenza virus strains. This test was done in cell cultures, that is, outside the body. Various concentrations of curcumin were added to cell cultures. The curcumin was added initially at different times to determine its inhibitory effects. Curcumin was added either prior to infection, at the time of infection, or 2 hours after infection. After the cell cultures were infected, the virus yield was measured at 12, 18, 24, and 30 hours post-infection. The results showed that viral infectivity was reduced in both influenza strains. The maximum inhibitory effects occurred when curcumin was present early in the infection. This seems to indicate that curcumin prevents the virus from attaching to target cells, which helps prevent the multiplication of the influenza virus. And, just as important, the viruses did not develop resistance to curcumin. While curcumin has been investigated in thousands of laboratory culture studies, as well as animal and human studies, I will now describe just a few human studies to help you understand the science behind curcumin's many benefits. In this first study, reported in the journal, Digestive Diseases and Sciences, 5 patients with ulcerative colitis, who were symptomatic from 1 to 32 years, and 5 patients with Crohn's disease, who were symptomatic from 11 to 26 years, were selected to determine whether the addition of curcumin to their existing treatments would be beneficial. Patients with ulcerative colitis took 2 doses of 550 mg of curcumin twice a day for the first month, then 3 doses a day for the second month. Patients with Crohn's disease took 360 mg of curcumin twice a day for the first month, then 3 doses a day for the second month. At the end of 2 months, 4 of the 5 ulcerative colitis patients eliminated, or reduced their existing treatments. And for the patients with Crohn's disease, the Crohn's Disease Activity Index, that rates the severity of the disease, fell by an average of 55 points. The author concludes that, based on these reports, we have shown that curcumin appears to have reduced the inflammatory response in 4 of 5 ulcerative colitis patients and 4 of 5 Crohn's disease patients. Improvement at an 80% success rate is pretty impressive. This study, reported in the journal Diabetes Care, was a 9-month-long randomized, double-blinded, placebo-controlled study of 240 participants who were pre-diabetic. To determine the progression to type 2 diabetes, changes in beta cell function, insulin resistance, and other parameters were monitored at baseline, and at 3, 6, and 9 months. All participants were provided with capsules to be taken 3 at a time, twice a day. Curcumin capsules had 250 mg of curcumin. After 3 months of the trial, 9.5% of the placebo group progressed to diabetes. After 6 months, 15.5% of the placebo group developed diabetes. After 9 months, 16.4% of those in the placebo group progressed to a diagnosis of type 2 diabetes. None of the curcumin group were diagnosed with type 2 diabetes. After 9 months, there were a number of measures that significantly favored the curcumin group over the placebo group. These included body weight, waist circumference, fasting plasma glucose, glucose tolerance test results, and measures of hemoglobin A1c. Another study that lasted only 7 days was recorded in the Indian Journal of Physiology and Pharmacology. This study involved 10 healthy male and female volunteers. They were chosen to study the effects of curcumin on cholesterol. At the start, blood was drawn and biochemical analysis was performed. The subjects were asked to take a single capsule containing 500 mg of curcumin for 1 week in the morning after breakfast. There were no restrictions on their diet. After 7 days the blood was drawn again and biochemical analysis were repeated. Curcumin administration resulted in a significant lowering in total cholesterol levels by nearly 12%. Average cholesterol levels dropped from 213 to 188.4. There was also a non-significant decrease in serum triglycerides in these subjects after curcumin administration, from an average value of 173 to 160.5. This very rapid improvement in cholesterol should give hope to everyone with elevated cholesterol levels. Thousands of studies have been done to authenticate the health-enhancing properties of curcumin. Even today, 53 clinical trials involving curcumin are currently recruiting participants or are in the planning stages. These trials are looking to see how curcumin affects such conditions as breast cancer, coronary artery disease, non-alcoholic fatty liver disease, chronic kidney diseases, obesity, prostate cancer, joint pain, and many other conditions. Most studies of curcumin use dosages exceeding 1,000 mg per day. So, if you want to experience similar benefits, you need to take a supplement that contains significant amounts of curcumin. The best curcumin supplements contain a compound in black pepper called piperine. This greatly increases the effectiveness of curcumin. Should you be taking curcumin? Just click the link to take our short quiz to see if you would benefit from curcumin. Still here? Okay. Here is just one more clinical study of curcumin for you to consider. First, some background information. Nearly 40% of the American population dies of some form of cardiovascular disease. A large amount of research is going into understanding the causes of the atherosclerotic process. You probably know that oxidized LDL cholesterol is a major contributor to the formation of atherosclerotic lesions. Preventing the oxidation of LDL cholesterol is a major step in reducing cardiovascular disease. ApoB is the main protein constituent of very low-density lipoprotein, or VLDL, as well as low-density lipoprotein, LDL. These are the bad types of cholesterol. On the other hand, ApoA is a protein carried in HDL, or good cholesterol. The ratio of ApoB to ApoA is strongly related to risk of myocardial infarction, stroke and other cardiovascular diseases. This study was reported in the medical journal, Mechanisms of Aging and Development. Here, 12 men from 43 to 70 years of age were chosen for the treatment because of their high values of LDL cholesterol. The treatment consisted in taking 2 tablets each day containing 10 mg of curcumin per tablet. The treatment caused a decrease in the levels of bad LDL cholesterol. This was accompanied by a rise in good HDL cholesterol. Specifically, the average HDL cholesterol levels rose from 46 to 79, while the LDL cholesterol levels dropped from an average of 190 to 117. Statistically, both changes were highly significant. In addition, the ApoB to ApoA ratio decreased very significantly from 94 to 63. The authors conclude that these results justify further research to test curcumin as a complement to standard treatments to help prevent and retard atherosclerosis. You've learned about the results of the research. So, now it's time to get serious about your health. All evidence points to the healthy benefits you enjoy with curcumin. We have arranged for you to get 3 free bottles of the #1 curcumin supplement on the market today, when you buy 3 bottles. That's a half-off offer. Get started by clicking to take our short quiz now to see how you can benefit from this miracle herb. Get started today. Click the link to take our short quiz right now.